Oftentimes, doctors always tell patients about the problem, but they never give them the solution. For example, you have severe periodontal disease. You have deep pocketing. Your teeth are loose. You have an infection. There's pus in your mouth. You have coronary artery disease. Your heart's not functioning that well. Your cholesterol is very high. These scare the hell out of patients. When a patient is told that they have a problem, they may or may not know that they actually have the problem, but oftentimes we tell them that they have a problem and it feels worse because people hear the story that we're telling them. They're hearing and they think the worst. You know, in America, 90% of all people dream that their teeth are falling out. It's the most common dream that people have in the United States. When a new patient comes into my practice, I'll oftentimes will say to them, I say, I know what you dream a lot about. And they'll look at me and go, well, how do you know? I go, because a lot of my patients feel this way. They dream that their teeth are falling out. And they always say, doctor, I'm surprised that you know so much. I know that much because most of my patients have that dream. They think about their teeth falling out because the people that see me have periodontal disease. I have one colleague, who'll go unnamed, that tells his patient about the problem but doesn't give him a solution. He says, go home, talk to your spouse about it, and come back and talk to me. He wants to make them fearful. He uses fear to, quote, sell them treatment. Because fear, he feels, will motivate them to do the right thing. In our practice, we do things a little bit differently. I don't want patients to be fearful at all. Just the opposite. I want them to be informed and knowledgeable about what their situation is. Because knowledge gives the patients a tremendous amount of power. You know the old story, you can give a man a fish and they eat for a day, or you can teach him how to fish and they eat for a lifetime. I feel the same way about healthcare. We're very preventatively oriented. So when a patient comes in with a problem, we immediately tell them what the solution is. Now, the solution may require surgery, it may require some significant amount of investment of time and capital and have to go through surgery. But when we're done, we're going to get them to a place where they're healthy and stable. And I teach them about the preventative aspects of care. So immediately, if I tell a patient that there's a problem, for example, yes, I notice that you have some periodontal disease, but the good news, I immediately say the good news. I tell them a problem, but I tell them that there's good news. I will always link that. So patients will leave my chair feeling this. Wow, I thought it was going to be much worse. I could tell them that they're going to lose all their teeth and we're going to replace them with implants. And they could say to me, wow, I thought it was going to be much worse. Why do they feel that way? Because I'm giving them a solution that's in their best interest. Because I will do everything possible to be in my patient's best interest. I'll meet them where they are. And where they are usually are someone who is uneducated, scared to death, and has no idea what their future is going to be. So we tell them, this is a problem, this is a solution. We connect with them. And that is very important because that moment of connection early on in that treatment process, which is usually the first 90 seconds in which I meet them, is important so that they can feel comfortable that we're doing the right treatment for them. And we are. I truly believe that we're doing that for our patients. I want to get them healthy. I see a very positive future for my patients, and I share my vision for their future with them. That sounds a little weird. I'm sort of like, I can see the future with dentistry. I can't see the future with, what's going to happen with the world, with global warming or with politics or with the stock market. But I do see the future with my patients, with their dental health, because I know exactly what will happen if they follow my instructions. If they brush, if they floss, if they see my hygienist every 3 to 4 months, if they get rid of the infections that are in their mouth, which is very common, decay and periodontal disease, we can stabilize them. Almost nobody will lose their teeth if they follow my instructions. Matter of fact, if they follow my instructions, they won't lose their teeth. How do I know that? Because we have plenty of research to back that up. So next time a patient comes into your practice, or anybody, it could be a failing roof, it could be one of your children having a problem at school, because we've seen it if we're adults. We've seen what they go through. Always say, hey, here's the problem. But that's always an opportunity. I have a friend of mine that says, what's the opportunity? So whenever something's happening to me, I'll call him up and I'll say, hey, John, he goes, what's your opportunity? Because there's always an opportunity. Because in the problem, there's usually an opportunity to do something really great. Now, my patients is pretty easy for me because I've been doing it for 40 years and I know what that can do for them. But they don't know that. None of my patients know as much about dentistry as I do, unless they happen to be a boarded periodontist that comes in with 40 years experience. But most people don't understand what I'm talking about. That's why I have to be there for them. We're almost like parents, and our patients are like children. We have the experience, we have the knowledge, and we're going to take care of them in a very, very gentle, comprehensive way that's filled with love and compassion. That's my message today. Always link the problem with solution. You'll be the gift to your patients. Have a great day, everybody.